We're going to go ahead and get started, and we're going to start it off with Mike Mattmuller, Mesothelioma Warrior and ADAO State Leadership Team Eastern Co-Regional Director, Fighting for the Future.
Hello, my name is Mike Mattmuller. I'm 35 years old, and I was diagnosed with pleural mesothelioma at the age of 29. Younger generation of patients that hear the horrible truth that they have been diagnosed with a generally thought of terminal disease. The worst part of this is that it could have been prevented. As most of us know, this is a disease that the only known cause is contact by asbestos fibers. So if we eliminate the use of asbestos in products, we can prevent contact from all future products. We will unfortunately still have to deal with what's out there. Take a look at this guy in these pictures. Does he look like someone who's dying on the inside? No, he looks like anyone in your late 20s, just married and looking to start a family. Then, in October of 2011, all that changed when I went to prompt care to get an x-ray. Just normal walking around, I felt fine. It was really just when I was active chasing my nephew or chasing around my dogs that I'd get a little short of breath. I'd felt like this before, but back in high school I displaced 4 ribs and just figured I'll go to get an x-ray, go to the chiropractor, be fine in a couple weeks. Boy, was I wrong. I was waiting the results for this x-ray for what seemed like forever. And so long, in fact, that actual cleaning person came in to clean the room while I was there. I asked him, what's taking so long? And he looked at me with this puzzled look and was wondering why no one had been in there to talk to me. He left shortly afterwards, and of course the doctor comes in right after that. He then tells me that my x-ray looks like my left lung has collapsed and they're calling an ambulance to get me to the ER. It was determined after a couple of tests that in fact my left lung was not collapsed, it was actually just fluid. They drained it, sent me home with some antibiotics for an infection. It said to follow up with a week. After that week had passed, I still felt generally the same, no real improvement. And as I went back to the doctors to get the follow-up, the x-ray actually showed that the fluid had come back worse. Of course, when they saw that, I had to go through the next step, which was going through an exploratory surgery where they inserted a chest tube and a drainage tube to remove the excess fluid from my lung. As I was going through that surgery, my wife got to hear the news first. I was still waking up from a recovery, and the doctor had already told her. So as I'm waking up, I see the doctor and my wife in tears, and the first words that, he may have said something else, but the first words that I truly registered were, "You have cancer." Loud and clear. The words I'd never dreamed I would be hearing in regards to myself. Mostly the fact that how could this be happening to me? I stayed in the hospital with the drainage tube in my left side for a few more days. I knew I had cancer, and at this point, so did my friends, family, and coworkers. When I was released from the hospital, we still had no answer as to what type of cancer I had or what stage. We were told that I would get the results immediately after surgery, but unfortunately that wasn't the case, and it really took the doctors over a month to finally make that decision. The reason is because I was so rare. In follow-up appointments, the doctor said that the 2 pathologists who had looked at my slides weren't positive as mesothelioma, but 90% sure. The reason they weren't positive is because I was so young and it would be such a rare case. It took actually Duke University's pathologists to finally make the decision. And luckily, our local thoracic surgeon had heard of this surgeon up in Boston who was leading pioneer in pleural mesothelioma surgeries. We were willing to go up there to meet with him and learn about the advanced treatment option that we'd be doing in mesothelioma clinics. But before I went up there, I had to go through chemo. I went through 4 rounds of Olympta and cisplatin, and those drugs are so toxic that it has to be administered over hours, basically over an entire day. And it just leaves you, as anyone who can tell you has had chemo, it's just an absolute horrible process. You're fighting everything from your stomach to your energy to trying to eat. It's just terrible. For about a month, and then, of course, the ironic thing is I had my last chemo treatment weeks before my 30th birthday. About a month after my last chemo treatment, my wife, her parents, and I made the trip up to Boston to meet with Dr. Sugarbaker. We drove 9 hours from Maryland in a car packed with hope. Once we arrived at Brigham and Women's Hospital in Boston, we were led into a conference room with a group of people, of other patients, and some of his support staffs. We went over the presentation, and we were taken to the medical exam rooms to just get some general tests to see what our current health was. As I waited my turn to get my vitals taken, I had met some other friendly people there in the waiting room. And it turned out that some of these were actually patients, and they gave me the hope that I could see that this mesothelioma, this diagnosis, it isn't the end. I had a fighting chance. We had a private meeting with Dr. Sugarbaker where he went over my latest scans and presented me as a good option for this surgery. So we marked our calendars for about a month away and headed back to Boston, this time via plane, to stay and receive the surgery. I was planning to be stuck in Boston for a few weeks. I was going to get this cancer out of me and be good as new in no time. The surgery that I had was an extrapleural pneumonectomy with heated chemobath. Essentially, they removed the majority of one rib, my left lung, and half my diaphragm, and my pericardium. Once that was done, they then filled my chest cavity with heated chemo mixture and let that rest in my system for a while. They then removed the chemo, put in a Gore-Tex to replace my diaphragm and pericardium that they had removed. They glued me back together and slowly woke me back up in the ICU. I spent about a week there, most of which I don't remember due to the painkillers I was on. I had the easy part that week. My wife, on the other hand, remembers that very differently. I know it killed her to see me in so much pain, and I tried my best to show her how strong I was. We were newlyweds, just gotten married a little over a year ago. We couldn't believe we were going through this at this stage in our relationship. Talk about a test of our love and strength for one another. It was a long and grueling and emotionally draining month and a half. Finally, on July 3rd, we rented a car and drove home to Maryland. The recovery from surgery took over a year, but I definitely could have used more time. At first, there was a struggle just to get up out of bed, but slowly and surely, I began to walk more and more, and if there's one thing that I remember the most from my stay at that hospital, that's walking that dang corridor, center corridor in Dr. Sugarbaker's hospital. It is now been almost 5 years from my surgery, and I must say a lot has changed. I now live a new normal life with my wife and beautiful baby girl in Maryland. Having my daughter has made me put this fight into an overdrive and pushed that much harder to working towards a complete ban of asbestos. While working through this whole experience, one thing is thankfully shown through as a beacon of hope and understanding, and that's the community of people that we have come into contact with, as many refer to it as the silver lining of this awful disease. All the patients, doctors, caregivers, lawyers, and volunteers we have met at these conferences truly give us hope as we continue to fight against this asbestos internationally. My case is what many who are diagnosed with mesothelioma consider a best case scenario. Think of that. Me standing here is the best case scenario, going through all of those, the chemo, the recovery, the surgery, all of that pain and suffering. That's the best case for a preventable disease. While it's very important to continue the research to cure meso and other asbestos-caused diseases, it would serve the greater population better to ban it so that no one is exposed by new products, because there is no safe level of exposure. It is my honor to be here before you and share my story, and hope that my daughter will look up to her father with respect and admiration in knowing that he fought as hard as he could and will never stop.